Battling conditions like heart disease or diabetes is difficult enough. Now imagine fighting multiple conditions at the same time.
Research is showing that many diseases have connections to each other. Dr. David Cherney joins us this morning to put this all into perspective for us. Doctor, good morning. Good to see you.
Good morning. Thank you for having me.
Okay, I think many people don't realize the impact that one condition can have on the body and the fact that it can actually trigger more issues.
Absolutely. So this is why it's being increasingly recognized that conditions like diabetes, for example, have major impacts on the heart and the kidney and the development of subsequent complications and diseases such as heart attack, stroke, and kidney failure. And in addition to that, there is increasing work being done around the connections between the kidney and the heart and importance around screening for those kinds of conditions, especially in people with diabetes, but also making sure that we treat people adequately when they have these conditions.
Can you give us more examples, more specific examples, for example, when you're talking type 2 diabetes?
Sure. So type 2 diabetes is the most common cause of kidney failure in Canada, as an example, leading to dialysis or a transplant. And as many as half of people who have type 2 diabetes eventually develop kidney complications, including kidney failure. And so that connection between having diabetes and the kidney is not just a matter of having high blood sugars or having abnormal blood tests, but it's the complications that we have to worry about, including not just kidney disease and heart disease, but it's the most common cause of blindness too. And so screening for it is of the absolute utmost importance, and we recommend that people with diabetes get screened at least once per year, sometimes more frequently, and have both blood and urine tests to make sure that we can identify it and treat it as early as we can and as aggressively as we can too.
Now, is all of this, doctor, is it relatively new? Is this a relatively new discovery?
That's a great question. So it's not new. It's actually been recognized for many decades that there is this important connection between diabetes, kidney disease, and heart disease. But unfortunately, we didn't have a lot of strategies to intervene and prevent the progression of those complications in the past. So now we can screen with blood and urine tests, and it's important for people with diabetes to know what their kidney numbers are, their GFR or their kidney function level, and how much protein they have in their urine, because based on those tests, doctors can now intervene with not just one or two, but more like 3 and 4 medications to protect the heart and protect the kidneys and prevent that worsening of disease.
How do we break the connection?
Yeah, so breaking the connection involves this really important emphasis on screening and making sure that we do those screening tests and that patients understand what those numbers mean. It's kind of like knowing your cholesterol and knowing that we have to treat cholesterol in people who have had a heart attack or a stroke. And it's the same kind of idea in people with diabetes, where it's critical for people to know what their numbers are, what they mean, and to bring it to the attention of their doctor if it's not been discussed, and make sure that those interventions are started and made as soon as possible. So screening and then making sure that all the medications that are indicated are used in a safe and effective way.
All right, some really important information. Doctor, appreciate you making the time for us this morning. Thanks so much for this.
My pleasure. Thanks for having me.
This portion of the morning show is brought to you by itsconnected.ca.